Good afternoon. I am Dr. Cece Jackson, and I am the Vice President of Mental Health Awareness of Virginia. And we would like to welcome you to our 2021 Advocacy Award presentation. And we want to thank you all for tuning in, especially our Facebook friends. We're excited that you will join us for this part of our annual Victory for Mental Health event. Our event also includes an online auction, shameless plug. Please go out to our website so that you can bid on some of the amazing art that we have out there that ends at 8 p.m. tonight. Mental Health Awareness of Virginia is the state's oldest mental health advocacy organization working for mental health since 1937. Our mission is to educate, empower, and advocate to improve the mental health of all Virginians. The annual informational handout that we have shows some of our service highlights of the past year. And under education and empowerment, we responded to over 5,000 calls on our peer-run warm line. We've had over 4,000 calls to our COVID-19 response call line, and 656 people took our recovery education webinars and training. We're excited about that. Under our advocacy work, we served on 5 different legislative groups, plus the Marcus Alert Crisis Services Planning. We helped present at Mental Health Advocacy Day during our legislative session. We tracked and testified on numerous legislative bills, and we supported and amplified efforts by others that significantly work for the transformation of mental health in Virginia. And today, we will celebrate those who have been a part of the successful transformations. For more information on our services, please feel free to visit our website at mhav.org. And now I introduce Anna Mendez, who is the president, who will present our Advocacy Award.
Thank you for that introduction, Cece, and thank you to everyone who is joining us on our live stream today. At Mental Health America of Virginia, we have an annual award that we present to champions for mental health in Virginia. We want to celebrate the significant victories that are happening in our Commonwealth on behalf of people living with mental health challenges and the people who love them. In 2019, which was the last time we presented this award, our award winner was Gray O'Dwyer, who worked very hard to remove the mental illness question from the Virginia Bar Association application. She identified that this question was posing a barrier to law school students who were not seeking access to the care that they needed for fear of needing to answer this question. In 2018, we presented this award to a group of Albemarle County high school seniors who proposed and drafted legislation requiring all of Virginia's public high schools to include education about mental health and mental health needs. They did this after losing a classmate to suicide, and that legislation is now law in Virginia, and Virginia high schoolers are now getting holistic health education because we know that our bodies do not end at our necks. This year, the Mental Health America Victory for Mental Health Award in Virginia is going to Senator McClellan and Delegate Bourne for their sponsorship of the companion bills SB 1315 and HB 2047. This was incredibly consequential legislation for criminal defendants in Virginia with mental illness as well as developmental and intellectual disabilities. Since 1986, these defendants had been prohibited from introducing evidence pertaining to their lack of ability to have the mental state necessary to form criminal intent. This legislation directly remedied that significant deficiency. So now, in addition to allowing defendants to introduce this evidence, it also requires that judges take into consideration defendants' mental health, intellectual disability, and developmental disability during sentencing and bond review considerations. It also requires training for court-appointed attorneys who are certified to provide indigent defense in Virginia. It is incredibly important that neurodiverse defendants, those with mental illness, intellectual and developmental disability, have adequate counsel, adequate representation at trial. And we know we're not trying to turn attorneys into clinicians, but we do want to make sure that they are able to best represent their defendants. And I'm really excited to be able to say that Mental Health America of Virginia has been able to participate in the training on this new rule of evidence, both for clinicians and for attorneys. We are incredibly grateful for Senator McClellan and Delegate Bourne that they brought forth this legislation, that they were even willing to try. And we are incredibly grateful for their steadfast insistence that this rule of evidence continue to maintain its consideration for mental illness. There was quick and unanimous support in the General Assembly for this legislation to apply to people with intellectual and developmental disabilities. But unfortunately, prejudice and discrimination brought some opposition to the inclusion of mental illness. And was it not for Senator McClellan and Delegate Bourne's willingness to stand up for justice, we would have much less to celebrate today. So with that, I am now going to ask Senator McClellan and Delegate Bourne to come up here, and I am going to present you with our awards. Senator McClellan, thank you. Thank you so much. Delegate Bourne, thank you. Thank you so much.
Well, thank you all. Good afternoon. It is an honor to accept this award, although I think the bill was really a labor of love for both Delegate Bourne and myself that frankly was several years in the making. Both of us heard from constituents over the years and stakeholders over the years of how our criminal justice system did not produce just results for individuals with mental illness, intellectual and developmental disability, and autism, particularly our school children. And that led to an effort to require the Supreme Court of Virginia to develop policies to make accommodations for such individuals. Unfortunately, that bill did not pass. So we decided we will do the study ourselves. And working with a group of students at UVA with Andy Block's, Professor Andy Block's public policy class, and working with stakeholders, particularly Anna, who I think spent many hours on the Zoom with us. We crafted this bill, and we stuck with making sure that mental illness was included because we understood that if you were, whatever your condition, and we understand mental health is just as important as physical health, but whatever your condition, if it means you do not have the required intent to have committed a crime, you should not be convicted of that crime. And that we wanted to make sure that your ability to present that evidence did not depend on what type of lawyer you had. So this was an easy one for us, but very grateful to accept this award, and I'll turn it over to my partner in good trouble.
Well, thank you, Senator McClellan. First, let me thank Mental Health Alliance of America in Virginia for this award. It's humbling and inspiring to be honored for what Senator McClellan described as an easy decision to advocate for this change in law. This change in law really was about recognizing equity principles, equality principles, and fairness, and really furthering this notion that for far too long in Virginia we have criminalized mental health issues. We're beginning the work. We've made some good progress, but there's still a long road to go. I would be remiss if I didn't thank all the folks who helped us along the way. As Anna said, it was not an easy victory to obtain, but knowing that we had, as I say, a crowd of witnesses behind us gave us the strength and the fortitude to be able to push forward and see it through to the end. And I'm not just saying this because she's here, but there was one person who, when things looked bleak and we might be resigned to taking less than what we knew we should have in this bill, she doubled down on our courage and really helped us see it all the way to the end and get what we wanted. That's Anna. Anna has been a tremendous asset, not only in this fight, but in the global fight for strengthening our mental health provisions. And I'm glad to call her an ally and someone that I can call on because these issues are complex. She's probably forgotten more than I've learned and I will ever learn. But it's just a testament to the types of people that really do work on these issues. And it's no secret why. We know someone who suffers from mental health illness. We have family members. And so as Senator McClellan said, mental health is healthcare. I mean, it really is. So as we look forward to next session and beyond, I know I'm ready to roll up my sleeves and tackle the next frontier because these issues are far too important, and folks all across Virginia need our help. And if we can play some small part in making their Virginia better, then it's an easy ask to make. And I look forward to continuing to work with all the stakeholders on these issues. Thank you so much for honoring us with your award.
Yes, and I'm Bruce Cruiser, Executive Director of Mental Health America Virginia, and I want to also thank Senator McClellan and Delegate Bourne for your persistence and your hard work and your dedication to improving the mental health of all Virginians. And just a final note that some people said, well, why are you having a victory for mental health? I mean, it's been one of the worst years ever for mental health. I mean, the pandemic has exposed the fact that more people than ever before are living through and suffering with mental health conditions. So it seems in some ways perhaps out of place to celebrate, but I think the way to look at it is it's even more important now than ever before to celebrate victories in mental health. Victories instill hope, and with hope comes healing. Without hope, there's only despair. So where we have a victory, a small victory or a large victory, we need to take the time to step back a minute and take that deep breath and go, yes, we have a victory. And with that, we've got more hope, and it inspires us to move on to the next challenge. And with hope also comes recovery, and with hope comes resilience. And if nothing else, we want to build a resilient mental health system in Virginia. So we hope to continue lifting up these types of transformational efforts, both small and large, whether it is a step that an individual takes every day to help themselves feel better, or steps that policymakers take to help the system get better. Ultimately, there is no health without mental health, and the sooner we all recognize that mental health is an essential part of everyone's overall health, then the more people feel free to talk about it when they don't feel right. The more others are likely to support them and lend a hand. And the sooner a person can get help, and then the better the outcomes. So we really thank you for being a part of this event and for sharing our mission to educate, to empower, and to advocate for mental health for all Virginians. So thank you very much for being a part of our event today. And if anyone has any questions, I'm sure the delegate and the senator will be glad to field that. Otherwise, we wish you a good rest of the day and a healthy, mentally and physically healthy year. Thank you.